a longtime client of mine was really stalled out in Invisalign. And this dentist was starting, prior to us enacting this strategy, was starting 3 Invisalign cases a year. 3 Invisalign cases a year. Naren, I'm going to be very blunt. At that level of Invisalign integration into the practice, those 3 cases are essentially a nuisance.
Yeah, it's 20,000 a year, right? At the most.
Well, you're doing it so rarely that you have no efficiency around those cases. No, in fact, this doctor even said to me that, Gary, I start the cases so rarely that when I do start a case, I have to go back and revisit all my Invisalign continuing education to make sure how I'm doing everything in that first appointment, the clin check appointment, accurately. And I said to this doctor, I said, what I think we need to do is we need to make an executive decision. We either need to ramp up our Invisalign cases and make it an important part of your practice, or drop it, or just drop it. And I said, just for my input, I'd really like to have you choose the former choice. Let's make Invisalign an important part of the practice, because you've heard me say that one of the things I love about dentistry is that we have the ability to change lives every day, and that could be something we do clinically. Or that could be something we do behaviorally. Perhaps someone just needed someone to listen to them. That's why I really treasure our profession. We have the ability to change people's lives every day. And taking an adult who has either crowding or spaces, and maybe even to the point where they don't smile much, or they're not confident about their appearance, and providing them beautiful, healthy, straight teeth can truly be a life-changing experience. We've seen patients blossom, from being introverted and shy and self-conscious about their appearance to where they literally, you look in their eyes and their eyes sparkle because they feel so good about how their teeth look. So growing the Invisalign component of your practice, or let's call it more broadly, the aligner component of your practice, is a great way to kind of piggyback on that concept of providing life-changing dentistry. Here's what we did. This practice had 2 hygienists, 2 full-time hygienists, 4 days a week. So 8 days of hygiene a week. We sat down, the doctor, myself, and the hygienist, and we went through this strategy. Very simple, but very applicable. I asked the hygienist for the patients in their chair when they're seeing hygiene patients to look for one of 2 conditions. Look for either crowding or spaces in the teeth. Now notice how simple this is, Naren. Crowding or spaces. Notice what we're not looking for. We're not looking for posterior occlusion. We're not looking for canine guidance. We're not looking for the orthodontic case type. We're looking for, wait for it, Naren, crowding or spaces. Every hygienist on the planet can identify crowding or spaces. And depending on what they see, crowding or spaces, the hygienist is going to say something like this to the patient. Naren, let's say you're the patient and I'm the hygienist. Naren, if there was a way to correct the crowding in your teeth without using brackets or braces, would you have any interest in that? And then we're going to simply hit pause, stop there, and wait for the patient's response. And what we found, the majority of time, the patient will say something like this. Yes, I realize my teeth are crowded, and I wore braces as a teen or a young adult. I was supposed to wear my retainer and I stopped, and now my teeth are moving backwards. And, I just don't want to look like I'm back in middle school again. But yes, I'd be interested in learning more about that. And then the hygienist can say, when doctor comes in to do your hygiene exam, I'll mention to doctor that you're interested in learning whether your crowding can be corrected with Invisalign. You may have heard of Invisalign. It's a state-of-the-art adult orthodontics. And again, you could say aligner treatment that is state-of-the-art adult orthodontics that does not involve brackets or braces. And then when doctor comes in, the hygienist makes a verbal pass-off to the dentist, to the doctor. Dr. Naren is interested in learning if the crowding in his teeth can be corrected with Invisalign. Would you do me a favor and take a look? Now, doctor takes a look, and the majority of the time, the answer is yes. And it's that simple technique. And the hygienist got on board, and they started doing this with every hygiene patient if they identified crowding or spaces. They made it part of their routine of seeing the patient. Of course, they made notes, in the clinical notes. If someone says, no, I don't have any concern about the appearance of my teeth. And then that's a possible answer, Naren. Would you agree that that could be a possible answer?
Yes.
No, it doesn't bother me a bit.
Mhm.
Then make a note in the clinical notes and don't bring it up again. We don't want to beat them
But
over
the
the head with
chances
it.
of those people who say that crowding or spacing doesn't bother them, I would think it's a minority, not the majority.
Very, very, very small minority.